so much for joining us this evening for another episode of Aestique Plastic Surgeons Secrets to Looking Your Personal Best. And this evening, we're going to be talking all about improving breast shape. Do you know there are several different procedures that can help improve your breast shape? Some of these procedures are insurance-based and some are cosmetic, but they both yield excellent results. And tonight, we're going to be talking about all of them. Joining me this evening is board-certified plastic surgeon, Dr. Linda Camp, and we're very excited to have you here on this Thursday evening to educate us, so welcome.
Thank you, Brianna. It's really a delight to be here to share part of my passion, which is improving breast contour and breast shape. But I'd like to take a minute just to say how much I appreciate working with you, Brianna. You know, these events are in the evening. Even though it's a new paradigm in our plastic surgery practice and reaching patients, giving more education in this public platform, it really is an investment in your time and your personal time. And I do thank you for that. So I'm excited to get started about breast shape change and how we can improve your look.
Well, thank you so much for those kind words. I really appreciate it. And it's my pleasure to be here with you. How do you change breast shape?
Well, there are many techniques that you can use to adjust shape. Something as simple as liposuction can be done to improve contour, to decrease bulky areas of the breast. The next step of treatment from our practice would then be surgical treatment, such as a breast lift for the saggy or ptotic breast, a breast reduction for the breast that is too large or out of proportion to the current body size. We can use fat transfer to complement or augment a breast. We can also use implants, which is the standard idea of breast augmentation. And of course, we also offer breast reconstruction for those patients who've had mastectomies for cancer. And I'd like to take a moment to say how important it is to understand the credentials of your surgeon. As a board-certified plastic surgeon, I spent many years in training, understanding all about the anatomy of the breast and how to make a breast when one has been totally removed. So the other topics that we're covering today are more for patients' preference. Breast reconstruction is really for patients' need. And we as board-certified plastic surgeons cover that whole gamut of breast care.
Well, we are very excited to be learning about this evening, so thank you for that great answer.
So most commonly, we would see patients come for breast reduction. So the procedure is typically done in this fashion. It's a keyhole pattern, and we, like a dressmaker, will design a pattern on the skin, and that's how we are going to reposition the nipple areola to a more lifted, elevated, perky position. And then the yellow represents how we decrease the gland for breast reconstruction. So these diagrams rendered by an artist show how we use that keyhole pattern on the skin. We lift the nipple areola up to that new top of the keyhole design, and then the breast gland is removed where the very light yellow is indicated in the second picture from the left. And then the side of the keyhole pattern come together in the middle to make what we call the vertical incision. And then the bottom of that skin pattern then tucks under the breast where the breast meets the chest wall. And that's where we take the extra skin off at the bottom of the breast. That's pretty much a standard breast reduction. There are other techniques available too, but I think I have some patient pictures to show that exact technique. This is a patient who has very matronly appearing breast. The word ptotic or saggy, true representation of her breast with the nipple areola at the bottom of the pole of the breast. This is called grade 4 ptosis. She wanted to have more appropriate breast for her age and wanted to appear more youthful in her breast shape. And so she was a candidate for a breast reduction through the technique we just showed. We also did a little liposuction to her axillary roll there under the arm, just to improve the contour of the chest wall at the same time. Our next picture shows her on the front view of the exact incisions that we just saw drawn by the artist. Now we also can decrease the nipple areola diameter a little bit to match the new, smaller, perkier breast, but the incision goes clear around the nipple areola, that dark disc, down the middle. You can see her scars look pretty well healed. And then underneath, we don't even see her incisions on this frontal view for her underneath incision. The next picture shows her in a 3/4 view, and you can kind of get an idea of those incisions on the bottom of the breast as well. But what a wonderful improvement for her contour.
Definitely is. She had to be very, very happy with that. And just a question for you, a common question that a lot of women will ask when coming into consult about this procedure is, will I lose nipple sensation or will it come back?
That is a very good question. I can tell you the national literature reports that nipple sensation can be lost in 7 to 15% of breast reduction breasts. Now, Dr. Lazaro and myself both employ a little bit different technique when we're doing our dissection of the breast. And I believe neither he and I know I have never had a breast that lost sensation or motor function to the nipple areola. So it depends on where that nerve is. Typically it runs in the pectoralis muscle and out to the nipple. So the technique that I showed you that was drawn by the artist does a very good job preserving the sensation. But sometimes that nerve runs right in the gland. And as we cut that nipple areola stalk, that pedicle of tissue, if we cut that nerve, that sensory and motor function of the nerve are gone. It's too small of a nerve to see, and we would not be able to repair that nerve if it were damaged. But again, in our practice, both Dr. Lazaro and I have never had a permanent deficit or loss of sensory or motor function.
Oh, that's great. That's wonderful. And I know it's something that our viewers would be interested in learning about. So thank you for that answer.
This next patient, although very young and very physically fit, has really matronly appearing breast, also pretty saggy. Her nipple areola are not symmetric, meaning the one breast looks like it's sagging and sits lower than the other breast. Her breast shape is also very different one side to the other. She wanted her breast definitely lifted on the chest wall, but also wanted that saggy skin envelope feel. So she underwent a procedure that was called a mastopexy with a breast augmentation. The next picture shows how an implant filled up that saggy skin envelope, and then a very small mastopexy just at the top of the areola was able to rotate that nipple areola higher on the breast mound and giving her better symmetry to her breast. So she was willing to accept this small scar at the top of the nipple areola. We had to lower the fold to get a fuller implant, which also helped to pick up her breast, giving her a more youthful appearance to the breast.
And looking at this picture, you can see her incisions. I would assume she's fairly recent. Is that correct?
That's absolutely correct. She's just 2 weeks after a crescent mastopexy, that incision at the top of the areola. It will can fade, and by the time around, it will almost be imperceptible.
Great.
We can take one more look at her side view, just to see how beautiful that upper pole fullness is, how the implant has complemented her cleavage, and just gives her a more voluptuous and alluring shape.
Dr. Camp, if you wouldn't mind, could you tell our viewers, we do have something called a pencil test that you can actually do at home, which can help people see if they need to have a breast lift or not, if an implant could just lift them. Could you go over that a little bit?
Yeah, this is a very common test that's used to determine if your breasts are a little bit too saggy. And it's a pretty simple test. If you lift the breast and place a pencil right up in that crease where the breast folds over to meet the chest wall, then you release the breast. If that pencil stays underneath the breast, then you do have a ptosis, That means your breasts are saggy on the chest wall and starting to show signs of age or maybe weight change. And we certainly have a procedure that could help you get a more youthful appearance. This breast on the left would certainly fail a pencil test. Now the breast on the right with the augmentation still has a little bit of a fold over, but again, we customize the treatment to meet your expectation. And this patient was pretty scar averse, meaning that she did not want to see that vertical scar or the one underneath the breast that goes from side to side of the breast. So knowing her expectation and intent for outcome, this small crescent mastopexy just really gave a lovely result with much better symmetry for her.
Really like what you just said. It's great that you really customize the procedure to the person.
Next patient represents someone who has a deflated skin envelope, deflated breast mound. She also has some asymmetry to the breast. Her right breast is smaller in dimension than the left. She's a patient with just lowering the fold a little bit, give her better symmetry, and also improve the contour of her upper chest to give her a much better appearance. She has a straight breast augmentation on her next picture to show how we were able to give her better breast shape. This patient also is highlighted in another webinar that was produced by Dr. Lazaro, myself, and you, Brianna, regarding breast augmentation, all the important details to understand about breast augmentation. But I will point out one more detail for her. As we fill up the skin envelope, we also increase the dimension of the nipple areola. So that dark disc in her deflated skin envelope was also very contracted. And now with the implant, it is much more symmetric and dilated in diameter. Something else that we would point out during a consultation. So you can see this beautiful 3/4 view. Again, a lovely upper pull fullness, excellent projection of the breast. This breast would definitely fail a pen test if we were to do a pen test on the right side breast. So our next patient is one who really does represent somebody that is truly hypermastic or excessively large breasted. She is a little bit larger lady, but her breasts are still out of proportion to her body size. And she is a patient who definitely would benefit from a breast reduction and also liposuction to contour that axillary roll on the side that kind of goes under the arm. It just really is an obstruction to your arm movement. So in our next picture, we can see her after breast reduction. She had that same standard keyhole design on the skin. You can see the beautiful position of her nipple areola more to the central mound of the breast, the vertical incision from the bottom of the nipple areola clear down and underneath to the chest wall. And then the next picture that shows her on the side view, we don't see her lower incision, but we can see how much improved her axillary roll and contour are improved by the liposuction that was done at the same time. Again, still very proportionate to her current body size, but still very large and voluptuous breasted lady.
A really excellent result. And breast reduction patients are some of the most satisfied patients. And for this next reason that you're going to talk about, what are the big benefits of a breast reduction procedure?
Brianna, so many people don't realize how much discomfort they're having, how much bra strap pain they get on their shoulder. Trying to go find clothes at a store is just difficult. So the next few slides just kind of hit the highlights of what really are some good benefits. Very large breasted women are usually very self-conscious. So once they feel they're more proportionate, their self-confidence improves, their socialization gets better, they're not as shy. They feel very normal instead of abnormal with out of proportion size breast. Easier to go shopping for clothes, and maybe your wardrobe would suddenly increase if you had a breast reduction and you were very large breasted, what most of us girls wouldn't mind. The next one talks about less skin irritation. because underneath the breast, a lot of moisture can develop and be held in a bra just against the skin. A lot of folks will even need to have prescription medications to treat rashes and moisture under the breast, much improved and even resolved with breast reduction cases. The bra strap pain, I've even seen ladies with scars because their bra straps have been so harsh to the skin across their shoulder area. And just reducing the weight of the breast can make that improvement happen. So we even have reduced back pain. Now, I wouldn't say that breast reduction would cure all back pain, but certainly taking the weight of the breast and making it less definitely helps improve lower back pain, certainly improves your ability to exercise and feel more energetic. And really, the next slide, our patients who have asthma tell us that their chest doesn't feel as heavy, they feel greater liberty for breathing, and that the decreased weight and decreased size of the breast really make them feel liberated, like they can breathe easy again.
Those are all great benefits. Any ladies that are even thinking about this, please call our office and come and see us, because you can have a consultation and you'll be able to determine, Dr. Kemp, I'm sure will explain a little later on how we do that, if you would be a candidate for it. So another really common question that we hear in consultation is, how do you know what size your breast will be after a breast reduction?
Brianna, that really is an important thing for physician patient to understand. You know, when a lady comes in, she has an idea of what is a beautiful breast size. And so we kind of tease through that information so that I can understand what your perception of beauty is. And my goal is really to make the breast size a size that meets your expectation. We would talk about how I can achieve that, making a large breast smaller, making a small breast larger, making a saggy breast more lifted, making a potential reconstruction patient a breast mound on the chest wall if one is taken away. But breast reduction, we would talk about what volume needs to be removed to achieve a size that you would be interested in. So the next picture shows a lady who is very interested in breast reduction. You can see she's a very full-breasted woman on her front view and on the side view. And she is out of proportion to her youthful age and to her athletic body style. She really wanted to have smaller breasts, but she didn't want them so small that she looked almost juvenile. But when we checked with insurance, you know, her insurance demanded a certain weight to be removed. And for me to offer an insurance-based work, I have to take off that weight that the insurance expects. So because she didn't want to be as small as what insurance demanded, she still chose to move forward with a breast reduction, but just less volume was removed. And we can see on the next picture, it was a good choice that we took off what she wanted removed and not what insurance demanded, because this breast is a beautiful breast. This breast is proportionate to her body size. It's been lifted very nicely to give her a more youthful and perky breast, yet one that meets her body shape. As according to insurance, she would have been a near mastectomy to achieve the weight reduction that they wanted done. So the next picture with her on the 3/4 view shows that she not only had weight or volume removed from the breast, but she also had a lovely lift at the same time. And breast reduction does involve lifting as well as reducing the breast. And I just love to point out the moles. So her pre-op picture, the mole between the two breasts, sits almost level with the nipple areola at the bottom of the breast. And then when we see that same mole on her chest on the right picture, it just shows you the power of lifting that we achieve with breast reduction. And again, a very, very happy patient with breast reduction.
And a beautiful result. Now that we talked about female breast reduction, how or is there a difference in the way that you do a breast reduction for males versus females?
Very outstanding question. You know, again, being board certified plastic surgeon, the differences between male and female anatomy is very, very important. You wouldn't treat one the same as the other. So in the next picture, we do have a male patient. We can see that his breast area is very feminized with projecting breast that have even ptosis. He would fail a pen test, which is not a masculine appearance of the breast area. So even though the rest of his body is a little bit more physically fit with muscle definition, the breast is very feminizing, leading to very insecure, lack of self-confidence in this young man. So he is a candidate to have this improved, and we can certainly help him. So understanding the anatomic differences, the nipple areola shape is very different for male. It sits very different on the chest wall. We would do our best to avoid scar tissue on the male breast, but there's often still a small disc of gland underneath that nipple areola that needs to be removed. And then we try less invasive techniques such as liposuction, which we've talked about. Liposuction to decrease the volume of tissue on the chest wall. Our next picture shows him the frontal view after surgery. Very pleased with the minimal scarring on his chest wall, the more lower lateral position of the nipple areola, which is more masculine in shape. And the next view, which shows him in his 3/4 profile, shows how lovely that anterior chest contour is on the right post-op picture compared to the left pre-op picture. Now, I do want to point out here on the post-op picture, we can see a little port access site on that upper axillary line, the top of the breast. This would be one of the sites we use to access this extra tissue with liposuction. In the lower part of the breast, we can see has some bruising still present. This is from the liposuction and contouring of the chest wall to kind of blend it all together. And then we do have to make an incision, usually at the lower pole of the nipple areola, where we go in and remove typically a hard disc of breast gland that help to promote that more feminine shape that we see on the pre-op picture. So this patient, still very early, about 2 weeks post-op, his hair is just starting to grow back, which will help cover up some of that bruising, but that should be gone here in another week or so too. Very pleased, very improved masculine contour for this patient.
Now, this you said was a liposuction. So a question that our viewers might have is that procedure covered by insurance?
Typically for the adult male, it is not covered. There might be some extenuating circumstances, say if one subareolar glandular structure was growing faster than the other, there could be a potential risk of a cancer or precancer. That patient would need a mammogram, and if there were abnormalities, insurance may cover a bilateral procedure for that male patient. But for liposuction and typical gynecomastia, it is not covered. On rare occasion, we may get a young male who's still in high school or junior high that's self-conscious, not participating in sports because of the breast shape. Rarely we can maybe get that covered because insurance feels that they still have development that they don't want to have stifled. But most often it is a self-pay procedure for men. For women, we talked about how insurance dictates the weight of breast gland to be removed. So in the operating room, we have scales, and as we remove the tissue, it is weighed and documented in the operative record, the weight of tissue that's removed so that we can meet insurance criteria. But in some patients during consultation, I just know that I can't remove what insurance is expecting. So we would still talk about what a smaller reduction would be and how that could achieve the beautiful shape that would match and be proportionate to the body.
We have talked about a couple different ways to improve breast shape. We've talked about the breast reduction, breast lift with an augmentation, breast augmentation, and then the gynecomastia. What are some other options out there for breast surgery to improve breast shape or any other breast surgery options?
So I've recently had a lot more self-pay patients wanting to improve their breast shape with fat transfer. And I think it's just more in the media, so people are hearing about it. Plastic surgeons have been doing fat transfer for almost 20 years now. And we use this technique to help plump areas that are depressed, or specifically in a reconstruction patient, to blend an implant to chest wall where that contour might look not as natural as we'd like it to look. But recently I've had a lot of patients who've come in and just wanted fat transfer to enhance their breast, which is a very good technique and can be used. Specific techniques need to be done so that the fat is placed in just little thin strands, so it has the best survivability in the breast. If you were to put fat in the breast and just pump in a globule of fat, it would have more chance of dying and necrosing away and leaving little bumps in the breast. So if you were going to fat transfer to the breast, you'd want to be careful and really have a board certified plastic surgeon do that work for you. Again, we understand the risk and benefits of the procedure and how to do it with better technique and skill so that the longevity and good health of your breast is retained. Fat transfer doesn't give shape like an implant, but it certainly gives volume and can complement your current shape. So fat transfer. I've also had a lot of patients come in who have wanted their implants removed, but still wanted to have some volume, and we're able to fat transfer those breasts to give them a little bit better shape after implants have been removed. So we also talked about reconstruction, and this is an area that I'm very passionate about. As you know, I came from a very strong practice with a lot of breast reconstruction patients. So breast reconstruction, I just wanted to touch a little bit on that. And I have a picture of a patient who underwent breast cancer reconstruction, young lady with not true breast cancer, but BRCA positive. So she underwent bilateral mastectomies. We started her work with immediate reconstruction using expanders. As she was really thin, did not want self tissue where we can take muscle and fat from your back or your tummy to make a breast. But this is her post-op picture after expanders were removed and implants were placed, and we did a nipple reconstruction. Now, she still has yet to get the tattoo to place her areolar disc around this nipple, but this is a good example of a patient whom I cared for that underwent bilateral mastectomy and breast reconstruction for her. She has not had any fat transfer at this time, and whether she chooses to have that in the future is yet to be determined. This next patient is a slide of the serial events that go on. Now, the upper left picture is a patient who had cancer and a mastectomy. She chose not to have reconstruction as an immediate or starting it right at the time of mastectomy. So she is now healed from her mastectomy on that top left picture. And when I took her to surgery to put in the expander, at that operation, I did a small crescent mastopexy on the opposite breast, her left breast, and the middle picture shows her with that expander reaching its maximum fill. Now, its purpose is not to be a breast implant. Its purpose is to grow a pocket on the chest wall and to stretch the skin so that when we see her in the bottom right picture, you can see how that stretched skin and that pocket now has some suppleness to it. An implant is in place. You can see how the incision looks even lower on the chest wall because we shape that implant and breast to give it more of a natural contour and tuck it up underneath where the breast meets the chest wall. She already had the mastopexy or the crescent mastopexy on her left breast. She has yet to choose to have a nipple, which is truly her choice, and then to tattoo an areolar disc on that breast. That's my preference when I do areolar reconstruction, is to have one of our team members do some tattooing for the color. So this is the series of steps that a patient would go through if they chose to do an expander treatment for their breast reconstruction. I think a reasonable outcome on the bottom right picture.
Absolutely. It's a wonderful outcome. And I think something that's good to point out is if somebody has breast cancer on one side of their, and one of their breasts, does insurance have to cover the other side for symmetry purposes or whatever you need to do to make it balanced and fitting to the woman's body?
So the true answer is it depends on your insurance provider and your contract. Most insurances will cover reconstruction of a mastectomy. If you choose to have a lumpectomy and radiation, most insurances will not consider that as a necessity to reconstruct a breast when only a small lump has been removed. But with the patient who's had a mastectomy, such as this patient, they do cover not only reconstructing the breast that's been removed, but they also cover any symmetry surgery to make the opposite breast match. So you can see this expander implant breast sits very high and perky. So her left breast, which is still her native breast, if it were very large, we might have had to reduce it. If it were just saggy, even more saggy than this one, we may have had to do that full keyhole pattern to lift the breast. Sometimes the breast is very small and a woman would choose to have a larger breast. So when we reconstruct with a larger implant, we can actually do an augmentation to the opposite breast for symmetry. And insurance is mandated to cover mastectomy breast reconstruction and opposite breast symmetry surgery.
Oh, great. That's really important to know. And I just want to point out, when a woman goes through this, it's such an emotional and trying time. And I think having a female plastic surgeon is really wonderful for this. And we truly don't have any board certified female plastic surgeons in the Pittsburgh or Greensburg area. So we're so lucky that this is a great area of your expertise that we can provide this for our female patients that go through something like this.
Well, thank you very much. And I say this is truly a passion of mine. And when I see patients, my first visit with you is really one of education. You know, I'm not striving for you to make a difficult decision right at the time of our consultation, although some come really educated in advance and tell me what they want done. But truly, the process can be overwhelming. And if you even bring a guest with you, we would allow that guest to attend the consult with you, even though we're honoring social distancing, because sometimes it's a lot of information to take in and you need an extra pair of ears to hear all the details. So we also offer second complimentary consultation for any patient who's been seen just for that purpose. If you have additional questions or your significant other would like to come and meet me, I'm very happy to have you back for a complimentary second visit so we can go over any of the details that maybe were a little blurry from the first consultation. Our goal is really to make you happy, give you the best breast shape that we can achieve for you, and achieve a breast that is beautiful as you would like it to be.
Thank you so much for all of that great information. And just want to jump into some more questions. Thinking about all of the types of breast surgeries that we had talked about to improve shape, when is a good time to have this procedure for these different types of breast surgeries we discussed?
Well, when we were talking about breast augmentation, more commonly that's in the younger patient who's very thin, very physically fit, little subcutaneous tissue, and they want to feel more feminine. So really anytime breast augmentation could be offered. Sometimes it's the woman with a little bit more age and has also weight fluctuation throughout their life, or say maybe pregnancy where the breasts were enlarged and now they're a little bit ptotic, but she'd like to get back to that youthful breast. So after childbearing is a very prominent time when women will come in for a mastopexy with an augmentation. Breast reduction, where we do the surgery inside the gland of the breast, can have some influence on a young lady's ability to breastfeed. And so sometimes we would consider recommending to wait until after childbearing if that was something that was very important to you. Most women with breast reduction can still breastfeed, but the volume of milk production might be less than babies need, so supplementation would be necessary. However, I have done breast reduction on women as young as 14 years of age because their breasts were so large because of hormone influence that they were just stifled with physical activity, insecure in school. This isn't something we take lightly. We make sure the pediatrician is on board and in agreement and the weight is stable and all the physical things have been tried to attempt to avoid surgery, but sometimes even in the very young, surgery would benefit them greatly. And of course, the breast cancer patient really doesn't have the luxury of choosing when to have cancer, but they do have the luxury of choosing when to have reconstruction. In most patients, immediate reconstruction can be started, and on rare occasion, we would recommend a delayed reconstruction. If the cancer was an aggressive behaving cancer or the cancer therapies they were on would cause a hindrance, if surgery would delay their treatments, we would recommend delayed reconstruction. But most often the patient can be the driver of the timing of breast reconstruction.
Wonderful. And we talked earlier when we saw the pictures of the breast reduction surgery, when you did the liposuction of the lateral chest wall or the axilla. Is that liposuction covered by insurance?
No, that's really not covered by insurance. That would be for self-improvement. It can be done right at the same time as breast reduction surgery and is often recommended by myself, even Dr. Lazaro, because to make a breast smaller and lift it on the chest wall, but still have these large rolls under the arm, number one, is not pretty. And number two, hasn't addressed all the problems that you have with the large breast and the full underarm. So to decrease those rolls in the axilla is not only helpful to you, but also gives better chest wall contour. We really work hard to make that as affordable as possible so that patients can really choose to help themselves and do that add-on procedure.
Dr. Camp, if someone's having a breast reduction and say they do that lipo of the lateral chest wall or the axilla, can they do liposuction in other areas? I guess what I'm trying to say, an insurance case with a cosmetic case in this instance.
We certainly can, and we do it very commonly. The benefit of that really to the patient is if it's procedures that we can put together at one operative time, you would have one recovery time. So if you have an insurance-based necessary surgery done, we can add to that some self-improvement surgery, even liposuction to the hips or to the thighs, inner outer thighs, maybe even a thigh lift if there's extra redundant skin. On occasion, we'd even consider doing an abdominoplasty with a mastopexy so that you could have your recovery at one time. This would really depend on your health status, the volume of weight to be removed, and your ability to undergo a certain length of anesthesia.
Wonderful. And we do have a question that came in, and the question is, if you like your breast size and you're considering a mastopexy or a breast lift without implants, will you lose any size?
That is really a no, because we don't really take any gland away when we're doing a breast lift. However, when we take that more tautic or saggy breast and lift it up, it actually can appear larger, even though we haven't put an implant in. And we have our patient content platform called TouchMD, where we have patients, of course, mostly Dr. Lazaro's patients, because he's been in practice with Aestique for many years. Some of my patients are starting to give us permission to use their photos on our TouchMD platform, but we would review patients who've had that type of work and be able to show you just what the outcome they achieved, what that looks like, and then be able to predict or project what your outcome would be like.
Oh, wonderful. And I just wanted to mention to all of our viewers, all of these pictures that you have seen today are actual patients of Aestiques. And if you want to dive into any more information on breast augmentation and breast lift or fat transfer, we do have a great library in our YouTube channel, which is called Aestique Medical. So please go and visit that YouTube channel, and you will be able to watch all of these other great webinars and learn some great content as well. And without any other questions, I really want to invite everybody to make another date and come and see Dr. Camp. We can do a virtual consultation, or we would be happy to do it in office. We do have a office location in Greensburg as well as in Shadyside. So if you want to email info@aestique.com, I would be happy to get that set up for you so you can come and see Dr. Camp. Just a couple of reminders as well. We do have a great webinar set for next Thursday, June the 11th at 7 p.m. And with Father's Day right around the corner, we thought what better time than to do a segment just for men. So Dr. Camp, would you like to talk anything about that to give our viewers an idea on what they can expect?
Oh, this is going to be just a fun webinar, because we do have a lot of male clients. You know, men are very particular about their appearance. And I would like to say maybe even more than women on occasion. We have so many procedures we can help to offer our men. We love to pamper them at the spa, and we also love to help them achieve their best outcome through surgical procedures if needed. A lot of athletic men still have those unwanted love handles at the hips or a little extra fat around the belly. We can certainly improve that with liposuction. We have a PRP that can be used to help improve hair growth. Just the gynecomastia, like you saw on today's webinar, is another procedure that men will seek out from us. We have a lot of things in the webinar for next time, and it's just going to be a good webinar. Hope you can join us.
Yes, definitely. And we will have some great specials in there as well for all webinar attendees. So ladies, get your men, your friends, anyone to come and join and watch it. It'll be a lot of fun, chock full of information. And with that, Dr. Camp, would you like to say anything and close?
I just want to thank everyone for attending these webinars. This new paradigm of medical practice has just really brought out some great opportunities for us to share, provide education, and hopefully help answer some of your questions. Stay safe, be well, and I look forward to meeting you at Aestique, either virtually or through a face-to-face consultation.
And thank you very much, Dr. Camp, for your time and all of your education on this great topic that so many people are interested in. And thank you to all of our viewers for taking time out of your evening to join us for this episode of Aestique Plastic Surgeons Spilling Their Secrets, all on improving breast shape. So if you haven't followed us yet, we did split our social media. We listened to everybody that wanted to see more before and afters and some surgical shots, some great live content with Dr. Camp and Dr. Lazaro. So please join our social media platforms on Facebook and Instagram. And as I mentioned before, please check out our YouTube channel, Aestique Medical. We have lots of great webinars on there that we did previously, as well as some other great content for you to view. So thank you so much for joining us. We look forward to seeing you next week at 7 p.m. on June 11th for our Just for Men webinar. And until then, we hope we help you live life counterclockwise. Good night.